Thank you very much for that introduction, and thank you for the invite to come and speak today. As you were saying, my name is Tripat, and I'm a dentist. And during my time as a dental core trainee in oral and maxillofacial surgery, that's kind of when I did a project with the oral healthcare for head and neck cancer patients. And after that work, I was invited to become a clinical ambassador. So I became an ambassador in January of this year. So it's a real pleasure to come and speak to you today. And my talk today is going to be about oral cancer screening and just what's involved in that process. Especially with the role of dental nurses. And I actually used to be a dental nurse before I became a dentist. I did that in my gap year, so I do have insight into that role as well. I need to use my mouse. So the early detection of oral cancer has actually become a recommended CPD in the recommended CPD section for CPD since 2018 by the GDC, and that's to regularly refresh your knowledge and actually improve your knowledge and ultimately improve patient safety. So it is an important topic, and it is one that's also recognised that needs to be looked at quite often by the GDC as well. But just before I get going into the talk, now hopefully this will work, I just wanted to ask the audience what you think your role is, I suppose, in oral cancer screening, whether you're working in the hospital, whether you're working in general practice, or if you're an oral health educator. So I don't know if you can type it in the chat or kind of unmute. I don't know what's the easiest thing, but if someone can type it in the chat, that would be great to see. Let me just have a look.
Right, it'd be good if we could put
absolutely
as many as possible into the chat box, please. Thank you.
So I will be talking about that actually, on how to go about that. But anything else, any other experiences that you might have had? Yeah, absolutely. So we've got oral health improvement and to educate and advise patients who actually have cancer, and early detection and education. Absolutely. Okay, good. So that's a good start. Thank you for that. And to promote access to the GDP for screening. Yeah, absolutely. Anything else? No? Okay, great. Thank you for that. I was worried no one would actually type anything, so thank you. Absolutely, that is a really good insight into what you also think. And absolutely, to educate care home workers in detection of oral cancers for dementia residents. Absolutely. So essentially, it's to educate and advise, early detection, awareness, and also for patients with cancer. So I will run through all of that today. So I'm just going to close this all off. So, excellent. So what I'm going to be speaking to you about today is why is it important? So I'm going to speak about the facts and figures of the latest data regarding this, what's actually involved in an oral cancer screening, going through in a bit more detail the risk factors assessment, history, and clinical examination, and what your role is in the team in a bit more detail, and how you can help and get involved, including everything that you've said there, and the role of the Mouth Cancer Foundation and the charity work that we do for, and also how to get involved with the charity as well. So that's just an outline of what I'm going to be speaking about. So why is it important? So there's a report that's published by the Oral Health Foundation called the State of Mouth Cancer UK report, and it's the UK's only comprehensive review into mouth cancer. So what I'm about to show you is the facts and figures that are sort of 2020 to 2021. So actually they're quite up-to-date figures, and it just, so everything that I'm going to show you is essentially from this report. So, unfortunately, there were 8,722 people in the UK diagnosed with mouth cancer last year. And the incidence rate has increased by 58% in the last decade. So that's quite a lot. And unfortunately, there were 2,700 deaths in the last year. But the key thing is that the last point is that early detection does improve the chances of survival from 50% to 90%. So if you were to have a later diagnosis, your chance of survival might be 50%, but if you have an earlier diagnosis, that really does improve up to 90%. So it really is a real key thing really to improve prognosis. In terms of public awareness, 86% of adults have heard of mouth cancer, but that stat hasn't actually changed over the last decade. And 80% can't recall a public health message about mouth cancer. So we've all kind of heard about, breast cancer awareness and prostate cancer and all this kind of thing, but there's not really a public health message about mouth cancer. And 62% of adults have never looked into their mouths for signs of cancer. So yes, we might say, okay, the majority of people actually have heard of mouth cancer, but also the majority of people have never actually looked in their mouth for signs of it. So that's also something to bear in mind. And also for younger people, 1 in 4 adults under the age of 34 have not heard of mouth cancer. So really it's more sort of the older people over the age of 34, I would say roughly in that stat that they've heard of it. So it's a real thing that, needs to be improved on, I think. The impact, so 62% of cases are diagnosed in their late stages, which affects the prognosis and quality of life. So as you just correctly said, that the idea is to raise awareness. Well, I mean, it's really important because 62% of cases are still being diagnosed in the late stages. And actually, because of COVID, since the lockdown, there's been a 65% reduction in referrals for mouth cancer. And that's not just mouth cancer has disappeared since COVID's happened. It just means that there's been a reduction in referrals. And as I'm sure we've all seen in the news that came out, as approximately 10 million patients have had cancelled or postponed appointments. And the last point is actually a quote from that report that I was mentioning, that actually during this time of lockdown, around 1 in 6 people have experienced at least one of the potential early warning signs of mouth cancer and have been unable to seek professional help. So the impact post-COVID as well is there. So there's still quite a lot of work to do, especially as people are now saying, it's really difficult to find an appointment with the dentist at the moment post-COVID. We're still in the pandemic, but post what we've just experienced. So the take home from that part is really early detection is absolutely key. It can really, really have an impact on the patient's quality of life, whether their survival rates and overall their prognosis as well. So that's something that really is key to bear in mind. So I'm just going to run through the oral cancer screening process, and that starts with the risk factor assessment and management. I'll then talk about the history and then the clinical examination as well. So all these components make up the screening. It's not just looking in the mouth and that's it. These are all components of the screen. So in terms of risk factors, these are 3 sort of the main ones: smoking, alcohol, and the human papillomavirus. And I'm just going to speak about each of these in detail. So smoking, the chemicals in the tobacco smoke actually lead to a weaker immune system and damage to the DNA in the cells. And that causes mutations that can lead to cancer. So that's how it works. So it will cause damage to the DNA cells and then uncontrolled mitosis, which is essentially a cancer. And the risk of getting mouth cancer almost doubles if you're a smoker. And these are things that, you should bear in mind and be okay to be telling patients as well. With alcohol, so mouth cancer rate is 2 to 2.5 times higher in regular drinkers than non-drinkers or social or occasional drinkers. But the key is the risk increases 30 times if the patient is both smoking and drinking alcohol. So really, that's quite a significant increase. With regards to the human papillomavirus, there's many types of the virus, but type 16 and 18 are usually the causes for the oropharyngeal cancers, and it's linked to around 73% of oropharyngeal cancers. Now, this type of cancer is linked to younger people. So remember when we said about 1 in 4 people under the age of 34 aren't aware of mouth cancer. Well, this is the kind of so this is the type of cancer that will be in their mouth. So it's important to be aware of that. And actually, oropharyngeal cancers usually are right at the back. So in the oropharynx, so in the throat really, and the base of the tongue at the back. So these often are hidden away or more difficult to see. So again, it's important to be aware of that area of the mouth too. And 16% of UK adults aren't aware that HPV is a risk factor for oropharyngeal cancers. It's the fastest increasing type of mouth cancer. So people might be aware that it can cause cervical cancer, but they're not aware of the link that that's also linked to the oral cancers as well. There has been a vaccination program for girls in secondary schools. And I'm not sure if you might be aware that actually in 2019, there was a beginning of the boys vaccination program as well. So I know it's being tackled, which is a really, really good thing. And I think it was in the news recently that cervical cancer has been almost completely eradicated because of the vaccination program. So that's amazing. But really, it's important to still be vigilant because this is still on the rise. And for those that might not have been vaccinated, or for those that, where it's still around in the population. So it's something to really be aware of. So in terms of a history, really, I think it's easy for the dentist to just jump into a clinical exam and take a brief history, and that'll be it, because a lot of the times you can see something and that's fine. But I think it's important to work together as a team with the dentist to ensure that a good history is actually taken, and to document exactly what that is. So I'm just going to run through the things that could be something that can catch your eye, that is causes a high index of suspicion. So the NICE guidelines say that something that is a lump in the neck, lip, or oral cavity, an ulcer, or a patch that's consistent with erythroplakia, so that's a red patch, or erythroleukoplakia, and that's a red or white patch. And also, if you're an oral health educator, you also examine in the mouth. So this is something to really look out for. And in terms of the history, you're looking at things that are unexplained or persistent or unilateral. It's not the same on both sides, or non-healing. You may or may not have pain, but there may also be trismus, so the limited mouth opening, or lymphadenopathy, so swollen lymph glands. And these are things that, you think, okay, well, that's not really common, or that's not usual. So what are we looking at here? And really build a picture of what your index of suspicion actually is. And so that will help you make your clinic, help kind of document and make the decision as to whether or not that's a problem or not. So examples of that are a non-healing ulcer for more than 3 weeks, a non-healing red or white patch that doesn't go away, a unilateral lump or pain for more than 3 weeks, or persistent swelling in the salivary glands, unexplained bleeding, mobility of teeth, change in occlusion, or non-healing socket. So if you were there with a dentist and any of these things are being said, it's important to note these things down. Or similarly, if you're an oral health educator and patients might have mentioned this to you, or you've seen it and probed a little bit more, history will always give you that important information as to whether or not the patient's even noticed something that's there, or whether the patient might say, oh yeah, I've had an ulcer and that's healing and it's going away, it's fine. So the history will really give you a clue as to what the patient thinks and what insight the patient has, or what their symptoms really are. So in terms of a clinical examination, this is something that I think as an oral health educator you can do, or as a dentist you'll be there to assist. And I think if we were in person, I would have called up somebody from the audience to come and assist me, and I would have done a clinical exam. But I'm just going to come out of this presentation and just show you the clinical examination, because often I think the dentist does do it quite quietly, and then will say, oh, it's done. I might not mention it to you. So I think it's important to then just say, okay, are the lymph nodes okay? Or, is everything okay? And I think I'm just going to show you a video from the Mouth Cancer Foundation website, which goes through what the dentist is actually looking at. I'm just going to play this for you. So please let me know if this doesn't work or you can't hear it.
Okay, now let's have a look at the examination in real time. Hello, come in. Just take a seat. As usual, we're going to start with the mouth cancer and soft tissue scan. Can you just turn your head from side to side for me? That's lovely. And just sit forward and do that again. Just turn your head from side to side. Yeah, that's great. Just pop your head back. Okay, Chloe. The left, buccal sulcus looks normal. The left corner of the mouth. The anterior sulcus, the inside of the lower lip. The labial frenum, right corner. Right buccal sulcus. Upper sulci, inside of the upper lip, frenum and parotid areas all look okay. Can you just say ah? The throat, soft palate, hard palate, and incisal papilla look normal. Stick your tongue out. On the right, the posterior floor, lateral border, dorsum, left floor, border look okay. And lift your tongue up. The anterior floor, the ventral surface of the tongue, and the lingual frenum all look normal. She's got a little lesion on the right corner of the vermilion border, but that's been previously diagnosed as a hemangioma. Okay, let's just feel you for glands. No, nothing there. It all seems perfectly normal. Well done.
Okay, so I think that's the key there, where it says some dentists may prefer to check the neck first before going in the mouth, but either way, both ways of screening are acceptable as long as it's done. And I think that's a really important video to just show that what's actually being looked at here and what should be covered in a clinical examination when a patient comes in, and this should be done for every single patient that comes in. So then in terms of what I've just covered, risk factors, the history taking, and the clinical examination. And really, now I'm going to go through what your role is in all of that. And I think the key message I want to get across is to be empowered to speak up and get involved with all of this. So the first thing is a risk factor control. So if you are in practice and you are giving the patient a medical history form, ensure that they actually do fill out the bit about the lifestyle. And if they've missed out, whether or not they smoke or not, or whether or not they drink, explain to them that actually this is the reason that we're doing this. We're looking at your lifestyle habits, because it will help us understand your risks, especially for things like things more sinister, such as oral cancers. And often patients are usually accepting of that, or they might ask you the question, okay, what do you mean? And, you can have that conversation with the patient and start to raise awareness, and really create, as I said in the slide, create the opportunity to raise awareness at all times. So that's in the point of risk factor control. And also afterwards, if you're an oral health educator, you're giving advice, make sure you take the time to give the advice that actually smoking can also cause detrimental problems in your mouth. And one of those things is oral cancer, for example. And also working collaboratively with the dentist. Now, as I said, I was a dental nurse. I know exactly the role and how it's important to work together as a team. And ultimately, you're doing the best that you can for the patient. So whether that's kind of just ensuring that you're highlighting whether or not on the medical history form, oh, by the way, this is what they've said about their risk factors, or, if the dentist has not done an extra oral examination, you can say, okay, well, the lymph node's okay, or is a TMJ okay? Anything that will prompt the point to say that actually this needs to be done. And also similarly for intraorally. And when it comes to documentation, I've just gone through some of the things that might be more suspicious. So those are the things that are really important to kind of note down if the dentist is doing the examination, and kind of it's a real thing to help as a team to kind of to get it all down, and to know that that's the important things in that history to note down. And also, at any point that you get a chance to create awareness and to raise awareness, one of those things is actually encouraging self-checking. And as I've mentioned before, there's lots of there's lots of people who have missed their appointments or who aren't able to see the dentist at the moment, and it's really, really important to encourage self-checking. And I will go through that a little bit later on in this presentation as well. So the other thing is leadership in team meetings. So you might go away from today's talk and go back to your practice meetings and just ensure actually, has everyone up to date with their CPD, or is it something that we need to look at? And how else as a practice do you think you can improve on this? So some people were mentioning about going into care homes, for example, or raising awareness. I'm sure people can go out into the high streets, etc., and just be there to raise awareness, and that can be done as a team. And that's something that perhaps you could take leadership on, or if you're working in a hospital, for example, again, in your governance meetings, is it something that you can potentially raise awareness for? I think it's really important to then be empowered and be encouraged to do this, because your role is absolutely vital in terms of trying to raise awareness. And a lot of the times the patients are way more comfortable talking to the nurses than they are to the dentist. So if there's a point where you think that something might be able to be said, then be empowered to say it. And I think if you're going to now go back to practice or back to the hospital and try something like this, again, having the team meeting and so making sure that everyone is aware, that's also really useful so that it can be more of a collaborative effort. I will also later on talk about the Mouth Cancer Foundation and the things that you can kind of get involved in with that. And that's something that, again, hopefully you'll be able to take home. So I hope that's helpful and clear. So I will just talk about the Mouth Cancer Foundation. It is the leading UK head and neck cancer charity that was set up in 2004, and it's dedicated to raising awareness of mouth cancer and supporting those that are affected by it. So it helps provide support for patients with cancers and survivors, as well as promoting good health and prevention too. So that's the website, www.mouthcancerfoundation.org. And it's important. It's also a source of free information for healthcare professionals, but also patients and carers as well. So we'll just now talk about, I've just spoken about your role. So this is hopefully some of the resources that will help you within that role. So now, I know somebody mentioned about, how you can help patients who've got cancer, if you do have cancer patients in your practices or your work settings. Some of the things that the charity does, they have weekly online support groups for patients with cancers, and also a community forum. And actually during COVID, there was a real increase in uptake of that forum. So I think patients do, and also a helpline and 24/7 chat for patients and their carers. It is a real big ordeal that patients go through when they are diagnosed. And I think these kind of things can really help build that sense of community and that sense of support. And I think if you're aware of this, then perhaps, you can mention it to patients or their carers that this is available in case they need some help. There's also a back to work guide, which has just recently come out, and patients who've had, that's mainly for patients who've had their treatment and they're now kind of trying to go back into normal life. And that's also that's a guide that's there that's really helpful. Patients sometimes have got altered diets and altered ways of talking sometimes, and that's a really good guide that will help explain to patients kind of how to integrate back and that kind of thing. So those are the things that kind of to be aware of for patients who've got cancers. But also in terms of oral health. Now, as I said, I know some of you are oral health educators, and these are mainly for patients who've got head and neck cancer. So the one on the left is something that I've written, and that's a guide that looks after your mouth before, during, and after the cancer treatment. So right from diagnosis about what needs to be done, through the treatment. So there's different treatment modalities in there. So namely chemotherapy, radiotherapy, and surgery. And it talks about the different side effects that can happen from those treatments, and then the different ways and options of management. Oftentimes patients have the sort of a cancer specialist nurse that they can get, have on hand. But sometimes when, it's important to, again, encourage the visits to the dentist. And I think it's nice for patients that actually, if they're a regular attender, going to the dentist during their treatment or after their treatment just brings back that sense of normal life. And I think that's really important for them. And this is a really good reference point for that. And it also talks about the mouth care after treatment as well, whether that's surgery or things like radiotherapy, especially because there's lots of long-term side effects, unfortunately, with that. And it's a good tool to reference to. The one on the right actually goes through the journey, the whole journey, and that's kind of from the start of what happens with diagnosis, biopsies, what happens with your diet, which team members do you meet, then the multidisciplinary team. But it does also go through things like oral health changes and recommendations for that too. So that's also useful resources. That's also available on the website. But in terms of now leaflets to raise awareness, there are some leaflets about the self-check and also a leaflet about HPV. And these are really easy leaflets to keep in your practices, in the reception area. And again, it's sort of passively raising awareness. And sometimes if a patient will pick it up, then it might incite the conversation when the patient comes into the surgery, or it might be something that they go home and read. But it's just something that's there for patients to look at and patients to read. And these are all quite easy things to read. And in terms of the self-check, the charity has actually pioneered the 2-minute life-saving self-check. And the leaflet on the left is also a good adjunct because it talks through the different signs that patients might not be aware of. So even things like, persistent sore throat or hoarseness or change in the voice or earache or constant pain or lumps or bumps that are unexplained, a white or red patch or persistent nasal obstruction. So these are the things that's why I was saying earlier that the history is really important, because these are very unusual symptoms. Something that's a hoarseness of the voice or the difficulty swallowing, for example. These are things that are not normal. And this hopefully is a trigger point for patients to read, to actually then to know when to seek help. And that all comes from the self-check. So again, I'm just going to come out of the presentation and I'm just going to go through and show you on the website what we've got for self-checking. So this is the home page, and if you just slide across to the self-examination. Now this is a 30-second video that you can show your patients, or you can again go back to the practices and show the dentist this, and however you want to work this out, this will be a good tool. It's something that doesn't have sound, so it's something that's really, really easy for you to just show your patients. 30 seconds is not a long time, and it goes through the different 7 steps of that, what you should be checking from the outside right through to the inside, going through the lips, the gums, the cheeks, and then it goes through the tongue, and then the floor of mouth and the palate as well. So that's a really easy thing for you to talk through with your patients, and it says look and feel for anything that's unusual. But the one thing that I think is also a good reference point, that's quite a quick video, and I know it's often busy in terms of appointments and things, and I know you can't really show things probably that are longer than that. But this is something that you can reference to your patients and tell them to watch it sort of afterwards in their own time, or have it playing in your surgeries or playing in your practice. I'm just going to show you, because this also goes through some pictures of the cancers, and it goes through sometimes there's sometimes that there are like sort of obvious cancers in some pictures, but some that aren't so obvious. So it's a really good tool for patients to then see what's normal versus what's actually not normal. So I'm just going to play this for you as well. And again, let me know if it doesn't work. This one does have sound.
Right Back at Mouth Cancer is a brand new do-it-yourself check for mouth cancer from the Mouth Cancer Foundation. Examining for the early signs of mouth cancer is easy. Everyone over the age of 16 should do it once a month after teeth have been cleaned. It takes less than 2 minutes, and it might just save your life. All you need is clean fingers, a good light source, and a mirror. At every step, you are inspecting and feeling for any lumps, red or white patches, changes in colour or texture, lingering ulcers, or anything unusual. Look at the whole face. Are there any swellings you haven't noticed before? Inspect your skin. Has anything changed recently? Have moles become larger or started to itch or bleed? Turn your head from side to side. This stretches the skin over the muscles, making lumps easier to see. Run the fingers under your jaw and feel along the large muscle either side of the neck using the balls of your fingers. Are there any swellings? Does everything feel the same on both sides? Using your index, middle fingers and thumb to feel inside of your mouth. Pull your upper lip upwards and bottom lip downwards to look inside for any sores or changes in colour. Use your thumb and forefinger to feel around and inside your lips, checking for any lumps, bumps, or changes in texture. Use your thumb and forefinger on the inside and outside of the gum, working your way around the gum to feel for anything unusual. Open your mouth and pull your cheeks away, one side at a time with your finger, to look inside. Look for any red or white patches. Use your finger in the cheek to check for ulcers, lumps, or tenderness. Repeat on the other side. Your tongue can be helpful to locate sore areas, ulcers, or rough patches. Gently pull out your tongue and look at one side first and then the other. Look for any swelling, ulcer, or change in colour. Examine the underside of your tongue by lifting the tip of your tongue to the roof of your mouth. Lift your tongue up and look underneath. Then look at the floor of your mouth for any colour changes that are unusual. Gently press your finger along the floor of your mouth and underside your tongue to feel for any lumps, swellings, or ulcers. Tilt back your head and open your mouth wide to check the roof of your mouth. Look to see if there are any changes in colour or ulcers. Check for changes in texture with your finger. Make a note of anything unusual. If you've had a cold or a sore throat, swollen glands or an ulcer, or you've just bitten or scalded yourself, for example, these should all heal in 3 weeks. If you have any concerns, see your dentist or your doctor who can advise if you need specialist help. The Mouth Cancer Foundation recommend that everyone over the age of 16 has a professional checkup for the early signs of mouth cancer with their dentist every year. It's also recommended that everyone over the age of 16 does a self-check on their own mouth after cleaning teeth. It takes less than 2 minutes and it just might save your life.
Okay, so I think that's really important, and I think just having these conversations really will incite awareness. And actually, one of the other stats from that report was that 41% of patients don't know that the dentist has done an oral cancer screening. So I know that it's quite common that dentists do or should do the oral, a soft tissue check and also an extraoral check. But patients don't know that that's been done. So I think just having these conversations really will help the patient. It's not something to alarm them about, but it's a bit like, just say the words, like when you go to the doctors and you're going for a smear test, or when you're going for a mammogram, you know that these things are being checked. Cervical cancer is being checked, breast cancer is being checked. So why is it that oral cancer can't be checked? So that's the kind of thing that I think it's important to have these conversations. So it's a really major tool for early detection. And 83% of adults lack confidence in what to look for. So these kind of videos and reference points for patients are really useful tools to show patients what actually is not normal, things that are not healing, things that aren't going away. But also the more that they look in their mouth, it's a bit like if you're checking for any other cancer in the body, like a breast examination. That's just for an example. As long as the patient knows what is normal for them, then that's fine. Then they'll be able to pick up what's not normal. And the public are generally 3 times more likely to perform a testicular and breast exam compared to a mouth cancer check. And yet the mouth is pretty much, we should be brushing our teeth all the time. You talk through your mouth, you eat all the time through your mouth. So it's one of those things that's a really easy place to look. but I think it's just that question of just trying to raise that awareness of the importance of looking. And I think the key is knowing you're normal. So the more that patients will look in their own mouths, the better. So oftentimes you'll know how your mouth feels. You'll know, oh, there's an ulcer coming up, or they've got a cut inside, I've bitten my cheek. But actually looking as well, and looking to see what you have in your mouth, you'll also be able to pick up, patients will be able to pick up what's not so normal. And I remember I had a patient with 4 Dyfe spots, and that's just, more prominently visible, minor salivary glands. The patient did ask me, and I said that to my nurse to note down. The patient was like, "What on earth is that?" But it just kind of incited the conversation to say that some people have this is your version of normal, and then you'll know next time when something isn't normal. But now that it's also documented in my notes, they're aware, we're aware that it's there, and I think that's really important. So I'm just going to speak about the charity in general, just lastly. And I just want to raise the point that it's the only charity raising awareness and support for mouth cancer. So if you can get involved with sharing our social media posts and links and things like that, it's really, really helpful just to raise the profile and raise the message and spread the message, for mouth cancer awareness. November is currently the Mouth Cancer Awareness Month, and there is a 10-kilometer awareness walk going on. So if you want to get involved with your families or your practices, there's still time to kind of register and go on that walk and fundraise for us. And that's the website mouthcancerwalk.org to actually register. So there's still time. And also, as I was mentioning before, trying to keep up with their CPD, the Mouth Cancer Foundation is actually bringing out a dental team accreditation scheme. So something to look out for, where you can get your CPD with the Mouth Cancer Foundation. So that's, again, something that's really useful, something that should hopefully be quite straightforward for you to get involved with. And that's something definitely to keep an eye out for. So those are the kind of the social media channels and the information, the contact details. So the email address is info@mouthcancerfoundation.org. And if you want to get any of those leaflets or get them ordered to your practices, that's the place to go to actually to get in contact with us, to actually order these things and try and help with that message of getting it all out there. So I hope that was useful. Thank you very much for listening. I really hope that was an overview, a good overview. It's quite a large topic. So I hope that was a good insight into kind of your oral cancer screening kind of part of it. So thank you very much.